Nazi dignitaries attended the showing along with contingents of uniformed SA stormtroopers. The showing lasted for several months, during which pilgrims from all over Europe made their way to the cathedral for this once-in-a-lifetime glimpse of one of the church's most holy relics. It is one of these scenes one rarely sees in the movies: an ancient Catholic cathedral, files of altar boys swinging censers, red-robed prelates chanting in Latin before a sacred relic, and columns of stormtroopers in swastika armbands as the honor guard. Hello and welcome to another edition of the Stench of Truth. I'm just going to do a general roundup here of things that have happened over the past week or so. First off, there's the President's budget, which has come before Congress and has been unveiled. And of course, it should come as no surprise to anybody that the budget includes tax increases on the rich. Now, I don't give a fuck about the rich, personally. So I don't really give a crap whether they get taxed more or not. The only thing that's bad about taxing the rich to pay for programs that you want is that it's a finite source of revenue. And it's self-limiting. And it also is self-limiting in a sense of overall performance. So I'm all for making the rich pay their fair share. And if that means increasing their taxes, then I'm all for that too. But you can't look at that as a sole solution to revenue problems. But a lot of people are lauding Obama because he has put in this budget very openly, you know, the cost of the war and the cost of all the other things and that sort of thing, and that's why the budget is so incredibly high, because he's identifying these things and supposedly funding them. Big whoop. It doesn't really matter. I mean, the fact of the matter is, whether it's a whole budget, a partial budget, or things are hidden or whatever's put out there, it is what it is. And whether he's supposedly transparent is just a bunch of bullshit as far as I'm concerned. It's just another gimmick that he's employing. I did want to make note on the fact that his particular views on what is important to accomplish with the budget are worthy of some investigation and looking into. First of all, he wants to increase the amount of spending in certain areas now significantly, and one of those areas in particular is healthcare. Okay. Now, healthcare needs to be reformed in this country, okay? I'm going to say this very clearly so everybody understands exactly where I come from, okay? Healthcare needs to be reformed in this country, desperately. But you know what needs to be reformed in this country? Not the care that people receive, okay? Not the system per se, okay? What needs to be reformed in this country is the fucking cost of health care, okay? Take a look around you and realize what the facts are, okay? Why is it that prescription drugs sell for considerably less in Canada and Europe? And I'm talking like a third of what you pay in this country for it, okay? Why are healthcare costs in other countries of comparable nature way less than what you pay in this country? Okay? Because the healthcare industry is thriving on what has traditionally been the wealth of this country by sucking it dry. Okay? So what needs to be reformed is the cost of health care. Now, I'm going to make a prediction, all right? If, in fact, Obama is able to implement some form of health care reform, it will not address the real issue, and that is the excessive cost. The only thing it will do is it will obfuscate and hide that cost so that the people who are giving the care will still be raping us with the cost. And that will include prescription drugs, that will include everything that is wrong with this system. It's all about it costing too much. You see, if they can provide prescription drugs and the same exact quality and level of service that we get in this country in other countries for a third of the cost of it is in this country, then they should be able to provide that service for that same fee here. The only reason that they don't is because they can charge us more because we'll pay it and we have the money to do it. Of course, we don't anymore, but that doesn't matter to the healthcare industry. They're going to still rape us as much as they can. So my prediction is that if Obama does succeed with some form of healthcare reform, it's not going to address the real issue, and that is the excessive costs. It's going to be cosmetic, or it's going to be a centralization, but in effect, the only thing that will mean is all of the huge amount of profits that pour into the healthcare industry are going to be directed through a central insurance provider, whether that be the government or whatever. And it's not going to address the cost issue at all. And we're going to be left exactly where we were before, with a system that is bloated and is paying too much for the care that we receive right now. So I say that while I would applaud healthcare reform, I do not predict that Obama's plan is going to fucking do a fucking thing for the fucking healthcare system or any fucking buddy in this country. The only thing it's going to do is going to end up channeling everything through a single payer system or something of that sort, and continue to pay exorbitant and ridiculous fucking fees for services, for prescription drugs, and for everything else. Until there is a fundamental change in how this is done, that is going to continue to happen, and I do not see Obama changing that, period. Okay? If he does, I'll be the first one to clap my hands and give him kudos. But it ain't going to happen, folks.